Nos encontramos en un episodio más de Fronteras de la Ciencia. Mi nombre es Daniel Bravo, soy investigador Ph.D. asociado de AGROSAVIA del Centro de Investigación Tibaitatá. Nos acompaña el doctor Olivier Braissant de la Universidad de Basel. Hoy les vamos a hablar sobre biocalorimetría. Estamos en el contexto del curso ACADEMIA AGROSAVIA en su tercera edición sobre biocalorimetría. Vamos a hacer una serie de preguntas que nos van a enseñar un poco sobre la historia detrás de cómo el doctor Olivier Braissant llegó a este tipo de técnica, cuáles las aplicaciones que pueden tener particularmente para el sector agropecuario y al final vamos a ver si tiene algún futuro este tipo de técnicas acá en nuestro continente. El doctor Olivier Braissant no habla español, por lo cual vamos a continuar la entrevista en inglés. Dr. Olivier Braissant, thank you very much to be here in Colombia.
And thank you for hosting me for this course.
For you, it's the second time in Colombia. How did you arrive here in our country?
It was great. I had a nice, a bit long flight, but it was great to arrive here and to see Colombia again, to see motivated students in your course. So I was very happy to come here again.
Thank you. So my first question is, how did you arrive to the universe of calorimetry?
To make a long story short, that was almost by mistake, I would say. I was very interested in calorimetry during my postdoc in the US, but I was coming back to Switzerland and my working position in University of Lausanne was cancelled. I was going to be unemployed and Dan Daniels, who would later become my boss in University of Basel, asked me if I would come to Basel and do some calorimetry because he was really interested in biofilm, which was the topic of my postdoc. So that's how I got started. I had to understand the machine, I had to get started with what the data from this machine were meaning and how I could relate heat and temperature to metabolic activity of cells and bacteria.
By the way, we have a calorimeter here in AgroSavia. It's a calorimeter which will be doing a practical and also theoretical things during this week. Dr. Braissant, we would like also to know what is the applications you can see with the isothermal microcalorimetry and especially with agricultural purposes that we are working here in AgroSavia.
I mean, calorimeters have been used a long time ago for doing soil science research. They've been used for biological research. And now, since the 2000s, they're becoming even more popular because we have reached kind of a limit with a molecular approach. And phenotypic approach and true measurements with calorimetry are becoming important. So in your context, in AgroSavia, I mean, calorimeters are very good at measuring bacterial and microbial activity in soils, but they're also very good to monitor the pathogen activity on fruits or vegetables. And finally, I mean, you can also look at probiotics, you can look at biocontrol organisms. There is plenty of application. I used to say to my students in Basel that the only limit to calorimetry is your imagination and the size of the samples that needs to fit in the calorimeter.
Thank you. That's really incredible, but it really depends on the creativity and of course the background. We were talking about the thermodynamics behind, but of course this is an important tool to do more analytical process working with isothermal microcalorimetry. We have this focus indeed in our course. We have main three focus regarding the use of isothermal calorimetry for environmental science, for food industry, but also for clinics. Tell a little bit about the clinics and the uses of this approach into the clinic or the biomechanics.
So calorimeters are a very sensitive instrument. You can detect a very limited number of bacteria in a small samples, which makes them very useful when you look for microbial activity, for example, in blood samples from patients or in urine samples from people having urinary tract infections. And with that, you can diagnose infection faster. And then knowing that you have an infection, calorimeter can also be used to decide which drug you're going to give to this patient by making a real-time drug susceptibility testing and then providing patients earlier with the right drug for their disease. And this way, I mean, you save time for hospitals and you save cost for the healthcare system, and usually it's all to the benefit of the patient that gets earlier treatment and thus recovers faster.
Very nice approach. And indeed, we have some interest also with veterinary medical issues. Do you have something to tell us about the use of calorimetry on this approach?
Of course, it's really new. We started a collaboration with a veterinary school in Bern, so a few kilometers from Basel. And people there are very interested in mastitis, which are infections from cow, which leads to milk spoilage and milk cannot be used. And this is very extreme cost in Switzerland because, I mean, cows that do not produce milk are not helpful for industry, and I mean, the milk industry in Switzerland is very important. So, I mean, veterinarians cannot let the situation degrade, and they were looking for a new tool to assess this type of infections and to be able to treat the cows much faster. And our preliminary results were just published in a veterinary science journal, and they show that with this kind of tool we can have a really good accuracy and be able to predict or to determine, in fact, which bacteria was involved in the infection, and also rapidly say this cow has an infection, this one is safe.
Incredible. So we have spoilage, infection disease detection, we have probiotics, prebiotics, heavy metals, something to do with heavy metals?
Yes, I mean, calorimetry not as an instrument that you have, but calorimetric titration is another technique which uses roughly the same principle. But with that, you can measure how much a metal will bind to organic matter. I used it for EPS and calcium in the context of dentistry for caries prevention. But the same is true for plant roots and microbial communities, and for example, cadmium or arsenic that you're very much interested in.
So you can see there is a lot of applications in isothermal microcalorimetry. We are just looking and picking some of them for this course. This is the third edition, but this is also to make a kind of a school. We need more people involved in calorimetry, especially because we have a lot of fields of application in agriculture, but in other fields also. And it would be great if year after year we grow in number of people working or related with isothermal calorimetry. A final question. What do you think about making bigger the teams of calorimetry in our countries, in South America, and especially here in Colombia? What is your perspective on this sense?
It's a tricky question, but I think Latin America is a very vibrant place for calorimetry. Each time I come there, I discover new teams which are interested in calorimetry, especially in the food industry. In fact, I've not seen that much on the medical side, but there are teams in Mexico also applying calorimetry to medical issues. And I think it's really growing. People are getting interested. I've seen from your students that they're really motivated to apply it. So I expect that in the next year you should get more people, and the more people you train, I hope it will be a virtuous cycle, and this is going to lead to a bigger community for calorimetry in Latin America.
Well, thank you very much, Dr. Olivier. It's a
Thank you,
pleasure
Daniela,
to have you here this week.
That is my pleasure.
We will have you in more and more lectures and courses here, and why not in other countries also in Latin America.
Thanks a lot.
Gracias a todos por estar en nuestro espacio de Fronteras de la Ciencia.